Eating disorders are on the rise, and the co-occurring mood and anxiety disorders that often accompany them are on the rise. The need has been greater than we've ever seen before. And in Orange County, Southern California, there's always been a need, but we've never been able to be here, and now we are. So we're really excited about that.
Where we're located in Orange County, we're just south of LA, where there's Hollywood and all of these supposedly ideal body types. We are kind of steeped in that culture here. We're constantly being inundated with information about these fad diets or which foods are good or bad, and placing that kind of moral value on food and your behaviors around food. And that can be kind of a breeding ground for eating disorders or disordered eating patterns. Food it's fuel, but it's also family traditions. It's also a social vehicle. If we can help patients get back to having that kind of relationship with food, that's the goal.
At Eating Recovery Center Irvine, we have a program for adolescents aged 12 to 17, and then we also have an adult program. We'll have a 7-day-a-week partial hospitalization, what I call day treatment. That is 10 hours a day, Monday through Friday, 8 hours a day on Saturday and Sunday. There are a lot of people who need daily support and containment around their eating disorder to really disrupt those eating disorder behaviors. And at a 7-day-a-week program, we can do that. So that program really helps to sort of disrupt that cycle of crisis care too. So we're going to meet a need that hasn't been met here. So we also have an intensive outpatient program, one for adolescents and one for adults, and that will be 3 hours a day, 3 days a week. And the intensive outpatient program will include a meal each time they come, a supported meal, as well as an evidence-based skills group and a process group.
I think the different levels of care definitely benefit just because they don't have to go looking for 2 different places. We can see them at PHP, and if we can monitor their progress and see that they are improving, then we can step them down.
So the treatment approach we use at ERC Irvine is a foundation of evidence-based therapeutic modalities. So we use ACT, DBT, RODBT, CBT, and those really provide the foundations. Those are the skill building groups for the patients so that when they leave here, they have skills to practice. That way they're not going to the eating disorder behaviors. And then we have these wonderful ancillary groups. So we offer things like yoga, spirituality, expressive arts, grief and loss group.
So for PHP, oftentimes our main goal is weight restoration. Also, these patients are coming in typically with their metabolisms a little bit out of whack. And so we want to get to the point where we can get them to a place where that their weight's stable and they can have a more stable nutrition plan in PHP, and that their eating disorder behaviors are, obviously getting less and less and less as time goes on before we transition them into the IOP program, where patients are going to need to be able to have the coping skills and know how to redirect themselves with those eating disorder behaviors, create their own meal plans, portion out their own food, and do that with their own responsibility.
I am really excited about the treatment team at ERC Irvine. We have a staff that is both head and heart. So there's so much competence here, and as well as so much compassion. And you really need both when we're working with patients with eating disorders. We have a medical team, so we have a primary care physician, psychiatrist, a nurse to treat the medical side of the eating disorder. Every patient gets a primary therapist that does individual and family therapy. We have dietitians who help address the nutrition component of the eating disorder. And we also have our own case manager at ERC Irvine, a lovely administrative assistant who will greet you with a smile when you walk in the door and help you feel comfortable. We just really have a wonderful, wonderful team, amazing humans.
Most treatment programs do not have their own MD. What happens is the patient comes to me and says, I'm going to start this program, and they need medical clearance. And that's it. And some of them have not been seeing a doctor at all, or they've been seeing a doctor who doesn't really understand eating disorders. My role is not only to monitor people together with our nurse, but also to educate, because people do not understand the complications of eating disorders, or they misunderstand them. One of the things I really love about ERC is their focus on the family, because families are so affected by their child's eating disorder. And what I tell them is, you never expected your child to have cancer. And if your child didn't have cancer, you would learn about it and learn a whole new language and a whole new way of being. And it's the same thing with an eating disorder. We don't expect you to know about them or to understand them from the beginning. And that's part of the team's work, is to educate parents about that.
We know that families love their loved ones who are here, and they really want to help them, but oftentimes they don't know how. So we are here to help educate them and coach them. When their loved one gets home, they can help sustain that loved one's recovery. So we have various support groups virtually, so family members and loved ones can access them from the comfort of their own home. We will have a parent group to help support the parents of our adolescents who are here in treatment as well. We have a beautiful space here. We want people to come in and feel welcome. We want them to have a sense of hope when they're here. And it was really designed intentionally to provide that. Therapeutically, the ambiance. All of the artwork is from local Southern California artists, so it's very coastal, very comfortable, very relaxing. We have a lovely teaching kitchen that we can offer cooking experiential groups as well. Eating Recovery Center in Irvine is right in the heart of Southern California, San Diego County and LA County on each side, and we're really strategically located between two freeways and only about 15 minutes from John Wayne Airport. We often get patients who come to us and they say, I'm hopeless. I have lost hope in terms of recovering from my eating disorder. But that's not true. There's always hope. And at ERC Irvine, we will hold hope for our patients until they can hold it themselves.